Hello guys, welcome to JC channel. Today I am going to explain about tobacco smoking. In this video, I will explain about the topics such as how people are getting into this habit, facts about nicotine, how tobacco damages your body, tobacco causing diseases and conditions, why to quit smoking and how to quit smoking, and after quitting smoking, what happens to your body. All these things we are going to discuss in this video. So come on guys, let's get into our video. According to WHO, tobacco kills more than 8 million people per year, including smokers and non-smokers who have experienced second-hand smoke. Compared to HIV deaths, smoking causes more death rate. Worldwide, Kiribati is having highest number of smokers, around 52.40% of their total population. In the final place, Sweden is there. Sweden is the country which is having least number of smokers, only 11% of their total population. Because of this only, people used to call Sweden as smoke-free country. So in India, about 12% of the world smokers are living. Up to 60% of total cancers among males in India are tobacco related. Next, we'll see about how people are getting into smoking habit. Most people who have smoking tobacco, they might be started this habit during their teenagers or young adult ages. There are many reasons for a person to start smoking. For some teenagers, to show their resistance against their parents, they may start smoking. Some people, they may feel pressure from their friend side and then being forced to start smoking. Some may be learn from their parents, relatives, friends, and they start believing that smoking is a way to release stress, something like that. Some people can think that they can leave this habit in a short time, but this is not that much easy to quit because this is a highly addictive habit. The reason is nicotine. Here we need to know some facts about nicotine. Nicotine is a chemical that is present in all forms of tobacco. Nicotine is highly addictive. When a person uses tobacco by smoking cigarettes or chewing tobacco or using another forms of tobacco, this will be entered into the body and activates the nicotine receptors in the brain. So the faster the delivery of the nicotine to your body, the greater the addictive effect of the brain. Cigarettes have been designed to give high levels of nicotine to the brain very quickly. When you smoke a cigarette, it will take only 6 to 10 seconds for the nicotine to reach your brain. This makes you smoking tobacco very addictive and very difficult to stop. When we inhale nicotine by a cigarette, it will be absorbed by the lung and released in bloodstream. Then it will be going to brain and heart. The brain reacts to the nicotine and it will be releasing some chemicals called dopamine. Dopamine is a feel-good chemical that makes you to feel happy, helps you to concentrate, gives you more energy, but this effect does not last long. Next we'll see about how tobacco damages your body. The chemicals which is present in the tobacco smoke can damage your body in many ways. For example, nicotine. Nicotine narrows the vein and arteries. This will damage our heart by forcing it to work harder and faster. This will slow the blood flow. Due to this, supplying the oxygen to the hands and feet will be delayed. Second one is carbon monoxide. Carbon monoxide prevents the blood system from effectively carrying oxygen around the body, specifically vital organs such as heart and brain. Third one is tar. It is a sticky substance that coats your lungs like a soot in a chimney. Fourth one is phenols. This will be paralyze and kill the hair-like cells in your airways. These cells are used to clean the lining of our airways and protecting from infections. Next, tiny particles. Tiny particles in tobacco smoke irritate our throat and lungs. It will be cause smoker's cough. Then ammonia, formaldehyde present in tobacco irritate your eyes and nose and throat. So finally, cancer causing chemicals. It will be make your cells grow too fast and abnormally. This can result in cancer cells. Now we'll see about some of the disease conditions that can be caused by smoking. Yes, the major disease is cancer. Smoking causes most lung cancers and it can cause cancer almost anywhere of our body. This includes lips, tongue, mouth, nose, esophagus, throat, voice box which is larynx, stomach, liver, kidney, pancreas, bladder, blood, cervix, vulva, anus and scrotum. Next is respiratory conditions. Smoking is the main cause of COPD, which is the short form of chronic obstructive pulmonary disease. This is the serious condition. This will be limits the airflow to the lung. Asthma and emphysema are the other respiratory conditions caused by smoking. Next one is cardiovascular system. Smoking is a major cause of cardiovascular disease such as CAD, stroke. Smoking increases the risk of blood clots which block the blood flow to the heart, brain and legs. Some smokers end up having their extremity amputated due to blood circulation problems. Diabetes. Smokers having the high risk of developing diabetes 30 to 40% higher than non-smokers. Next thing is infections. Smoking weakens our immune system. Due to this, smoker can affected by bacterial and viral infection very easily. Then coming to dental problems. Smoking increases the risk of gum disease, tooth loss and tooth sensitivity. Next problem is hearing loss. Smoking reduces the blood flow to the inner ear. Smoker may lose their hearing earlier than non-smokers. Next one is vision loss. Smoking damages the eye and can lead to macular degeneration. This is the main cause of blindness. Then fertility problems. Smoking will make it more difficult to fall pregnant in women and it affects the sperm quality in men. Next one is osteoporosis and menopause. Smoking is a risk factor for osteoporosis and in women it may result in an early menopause compared to a non-smoker. Now we'll see about why we need to quit smoking habit. Smoking will affect majorly three things. Number 1, ourselves. Number 2, the people around us. Number 3 is our financial background. So, as I said earlier, smoking affects almost every part of our human body and it increases the risk of many diseases. Smoking also affects how you look and how you feel. Then, effects on those who are around you. As a smoker, they can affect the health of other people. When the people breathe in smokers' second-hand smoke, this means they are breathing the same toxic and cancer chemicals like smokers. Third thing is financial effect. Smoking is expensive. Just will do one calculation now. In India, cigarette pack containing 10 cigarettes in an average around 120 rupees to 180 rupees. If a person daily smokes 5 cigarettes, one cigarette price is 15 rupees. It means per month he is smoking around 150 cigarettes and 1800 per year. It costs 2250 rupees per month and 27,000 per year. So the person is spending around 27,000 for spoiling his health. Now, how to quit smoking? Smoking is addictive. It is hard to stop, but with the help and support, we can quit smoking. Quitting smoking can be one of the most difficult things. Most smokers say they would like to quit and may have tried at least once. Some are successful in the first time, but others try a number of times before they finally give up for good. To quit smoking, follow the quit plan. So, you need to know your trigger points. First one is habits. Your smoking may attach to with some regular things you do, such as when you drink tea, coffee or juice after finishing meal, or talking on the phone, being with the friends, and while taking a break. These things may trigger you to smoke. Second one is emotions. Your feelings are connected to smoking too. You might smoke for comfort when you are sad or angry, to cover up uncomfortable feelings, when you are bored, to give yourself break. Even when you stopped smoking, the links between smoking and everyday feelings are still there in your mind. It will take some time to break those links. The third thing is social situations. There are a lot of social situations where you will be around other smokers. For example, going to the pub, parties, tea shop, having smoker friends. It is not possible to completely avoid other smokers. So you will need some strategies to help you to stay away from smoking. Fourth one is withdrawal. If you have been smoking for a long time, your body is used to regular doses of nicotine. When you stop smoking, you will experience cravings during withdrawal that can trigger the desire to smoke. For example, craving a taste of cigarette, smelling a cigarette smoke, feeling jittery or anxious, and wanting a smoke to calm you. Keeping a quit diary can also help you to identify what makes you want to smoke and how much you are smoking. Each time you have a cigarette or feel a craving, note the date and time, what you are doing, what you are feeling, and how strong the craving is. Even after a couple of days, you will have a good idea about your smoking triggers. Knowing your triggers can help you to choose the best method to quit. Now we'll see about the quitting methods. There are 3 types of quitting methods I am going to tell now. First one is going cold turkey. There are many different ways to quit smoking. Giving up smoking suddenly with no outside help or support is known as going cold turkey. People who use this method rely on their willpower to get away from smoking. Second one is gradually cutting down. This method slowly reducing the number of cigarettes you are smoking until you have quit completely. It is not effective as quitting completely, but it might be a good place to start if you are not ready to quit right away. You can cut down by slowly increasing the time between cigarette, reducing the number of cigarettes in your packet each day. It is still a good idea to set a quit date and work towards that. Third method is nicotine replacement therapy, which is called as NRT. NRT aims to reduce the cravings and withdrawal symptoms that occur when you stop smoking. If you use properly, NRT make a big difference in helping to quit suddenly, successfully. NRT can be available from pharmacies and some other supermarkets also. This they will give without doctor's prescription. It comes in different forms such as patches, gum, nasal and oral sprays and inhalers. People can ask, how does it help? Here is the answer. By providing small measured doses of nicotine into the bloodstream, you are not getting the harmful chemicals from the tobacco smoke. This will reduce the physical withdrawal symptoms, so we can focus only on a situation and emotions that trigger your desire to smoke. What happens to your body after quit smoking? When you quit smoking, you will have a withdrawal symptoms. These can last from few days to few weeks. It's different for every person, but they are temporary. Now I am going to tell some common symptoms and tips for dealing with them. First one, when you are feeling tense or irritable, just go for a walk. Take a deep breath. Meditate and do some stretching exercise. Second one is depression. If you feel depression, use positive self-talk. Speak to your friend or family member. Third one is appetite change. For this, you need to follow well-balanced diet. Choose healthy, low-fat snacks such as fruit or vegetables. You might have stomach aches and other digestive issues. For this, you need to drink plenty of fluids. Eat lot of fruits, vegetables and high-fiber foods. Fifth one is insomnia. It means you can't get sleep. For this, you have to avoid beverages containing caffeine, particularly before going to bed. Example, tea, coffee, cola. Sixth one is difficulty in concentrating. For this, you need to break your large projects into small tasks. You need to take regular breaks. Then seventh one is cough, dry throat and dry mouth. For this, you need to drink plenty of fluids. Then eighth one, it is a dizziness. Your body is getting more oxygen, so you might feel a bit lightheaded. So just sit down and rest until it passes. Now we'll see the benefits of quitting smoking. You will feel the benefits of quitting almost straight away as your body repair itself. Depending upon how much you smoked, you should start seeing benefits in a week. In 20 minutes after quitting smoke, your heart rate and blood pressure will go down. In 12 hours, excess carbon monoxide whatever found in your blood, it will go out. In 5 days, most nicotine is out of your body. In 1 week, your sense of taste and smell will be improved. In 2 months, your lung will stop producing extra phlegm caused by smoking. In 3 months, your lung function and blood flow will be improved. Then in 12 months, your risk of heart disease has reduced to 50%. In 5 years, your risk of stroke has dramatically decreased. After 10 years, your risk of lung cancer is less than 50%. In 15 years, your risk of heart attack, stroke is almost same as that of person who has never smoked. When you quit smoking, overall health will be improved. I hope the information shared in this video was really helpful for you guys. Please like this video, share to your friends and please don't forget to subscribe our channel. Please do keep supporting. Thank you so much for watching this video guys.